Well, I'm O.P. Yadav. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. Certainly, the results are different both in short term and in long term. In short term, it has been shown that diabetes is a systemic disease and so is atherosclerosis. So if cholesterol is deposited in the arteries of the heart, it is not possible that it won't be deposited in the arteries of the brain or in the kidneys or the rest of the vasculature. Therefore, these patients do have associated multisystem involvement, and the chances of renal failure, of CVA, that is cerebrovascular accidents, or wound infections is much higher in diabetics. They tend to spend longer time in the hospital during their hospitalization, and even their mortality and morbidity is higher. Similarly, we find that the long-term results in terms of survival and the graft patency rate are much lower in diabetics as compared to non-diabetics. Even in diabetics, we find insulin-dependent diabetics do much worse than the non-insulin dependent diabetics. However, to some extent, this can be nullified by aggressive control of the risk factors and of blood sugar, and one should aim to keep a hemoglobin A1C, the glycosylated hemoglobin, between 6 and 7 in these patients.